Hello. In this video, we are going to talk about basic life support training, how to save the lives fast. First, introduction to basic life support. Why basic life support matters. Cardiac arrest can happen anywhere, anytime. It can happen at home, work, or in public. Immediate CPR can double or triple survival chances. CPR means cardiopulmonary resuscitation. BLS skills empower anyone to act before medical help arrives. There are four key principles of basic life support. 1. Early recognition. Spotting cardiac arrest, such as unresponsiveness, no breathing. Second, early CPR. It keeps blood flowing to the brain and heart. Third, early AED use. AED means automated external defibrillator. It restores a normal heart rhythm with defibrillation. Fourth, early advanced care. Paramedics takes over for the treatment. Remember, the faster you act, the better the outcome. Next is the chain of survival. There are 6 critical steps to save life in cardiac arrest. Number 1, recognize emergency and call for help. Check for unresponsiveness. Are you okay? Second, call emergency services. The number can vary, depends on where you live. 911 in the United States and other parts of the world, 108, 112 or other local numbers. Start CPR immediately. Push hard and fast in the center of the chest. Third, use an AED, automated external defibrillator if it is available. Turn it on and follow voice instructions. Fourth, provide rescue breaths if trained. Give 30 compressions and 2 breaths. Fourth, advanced medical support. Wait for EMS, which is emergency medical services, or ambulance to arrive. Sixth is post cardiac arrest care. Hospital treatment improves long-term survival. So the post cardiac arrest care is also as important as early BLS. CPR for adults and children. Step-by-step CPR guide. Number 1, check safety. Ensure the scene is safe. For example, if the patient is a victim of traffic accident, the patient needs to be cleared away from traffic. If the patient is a victim in the construction site, needs to be away from debris and other potential dangers. Second, check responsiveness. Tap and shout, "Are you okay?" Third, call for help. Yell for someone to call EMS/ambulance or get an AED, automated external defibrillator. Fourth, start chest compressions. For adults and children, adults and teens, hand position has to be heel of one hand on the center of the chest. The depth at least 2 inches, which is equivalent to 5 centimeters. The rate of compression has to be 100 to 120 compressions per minute. In between the compressions, you let the chest to recoil. Don't lean on the chest in between the compressions. Very important point. In children, meaning 1 to 12 years of age, use 1 or 2 hands. Compress 2 inches in deep. It translates into 4 to 5 centimeters. Infants under 1 year, use 2 fingers, compress 1.5 inches deep. Rescue breaths. Tilt the head back, pinch nose, give 2 breaths. Each breath should be 1 second length. And when you give a breath, make sure the chest rises. Very important. The next point is using an AED, automated external defibrillator. How an AED works. It analyzes heart rhythm and delivers a shock if needed. It is very safe for untrained users. Just follow voice prompts. Steps to use AED. Turn it on. Open the lid or press the power button. Second, attach pads. In adults, place one pad on the upper right chest and the other on the lower left side. In children and infants, use pediatric pads if available. If there are no pediatric pads, one can use adult pads, but the pads should not touch each other. They need to be kept apart. In infants, oftentimes you have to use one on the front and the other on the back of the chest. Stand clear. Let the AED analyze the heart rhythm. It may take 10 or 15 seconds. Deliver shock if advised. Ensure no one touches the victim. No one touches the victim during analyzing the rhythm and during shock. Resume CPR and follow AED instructions. The CPR needs to be continued. It should not be broke more than 10 or 15 seconds. Important. Never remove pads. EMS will take over. AEDs can harm. They only shock if needed. Finally, choking relief and special situations. Choking rescue for adults and children. Ask, are you choking? If they can cough, let them try to clear it. If they can't, perform abdominal thrusts. That is called Heimlich maneuver. Stand behind, wrap arms around waist. Make a fist above navel. Thrust inward and upward. As good as possible so that foreign body will come out. For infants, you need to give back blows 5 times and turn them around and give chest thrust 5 times. When you do that, make sure the head is below. It's kind of upside down so that the foreign body can come out easily. When to stop CPR? The person can start breathing normally, then you can stop. When EMS arrives, emergency medical services arrives and takes over, or you're too exhausted to continue. Remember, even imperfect CPR is better than no CPR. Practice and preparedness. How to stay ready. Take a BLS course. Hands-on practice improve confidence. Learn AED locations. It may be available in malls, offices, and airports. Teach others. Share this knowledge with family and friends. Final reminders. Don't fear mistakes. Doing something is better than nothing. Stay calm. Panic slows response time. You can save a life. In an emergency, be the help until help arrives. This concludes this video on basic life support.